My name is Jackie. I'm here today to talk about my two new hips. Following my consultation and knowing I was going to have my first right total hip replacement, I went to pre-op, which everything was fine. After pre-op, I came to the hip group and I was assessed by the occupational therapist, who then advised me on what equipment to have and what type of equipment I would need at home. The very good advice I received at the hip group prepared me for home with all the things I had to do, because having no help at home, I didn't really know how I was going to cope. But they gave me some very good advice on what to do and how to prepare and how to cope at home. Then I came in for my surgery. I was a little bit apprehensive because not knowing what to expect or what to do, but thinking about the new hip I was going to be having and all the things I'll be able to do that I haven't been able to do for so long. And I didn't think about the pain. I'd had so much pain, but the pain with your new hip is nothing compared with what you've already had. And also you have to then, once you've had your hip, is to look forward, not backwards, to the future and what you'll be able to do. First day after surgery, the nurses got me out of bed and I stood up for the first time in nearly 3 years. It was a wonderful feeling, and also with the equipment that occupational therapy had given me, I was able to put trousers on, remembering not to bend down, not to twist or not to cross your legs, which is the three most important things that you have to remember. And crossing your legs is the most natural thing you want to do, but you had to learn not to do it. Then the physio gave me what I considered a very, very good piece of advice. She said, when you walk back with your sticks, walk normally as though you're walking down the road or walking out of the ward on your way home. And this I did, and I felt walking down there with the sticks, I was on my way to recovery. Whilst I was in hospital, I was given some exercises to do by the physios, which I continued to do whilst in hospital, and which I also did and continued to do at home. I continued to walk around my home. I went into the kitchen and then into the dining room, sitting down and getting up and walking so that I could get exercise for my new hip. And also then I did my meals with the help of some friends who were very good, who helped me. When I went out for my first follow-up appointment, after 7 weeks, I walked without any sticks. I felt that confident that I wanted to walk and get the benefits of both my hips without using sticks. And I thoroughly recommend having total hip replacement. There's nothing to be afraid of. You have to think positive, and also you have to think of the benefits you're going to be getting from either one hip or, in my case, two.